Hello. Hi, good afternoon. My name is Emily Morris, and I'm here to present my group's investigation into the impact of COVID-19 restrictions on the mental health of LGBT individuals. Or otherwise, the pandemic was a rough time. How did it affect the LGBT community? So, here is a little background to our study in a handy little flowchart. As you can see, we've got quite a few components to tackle here, so I will try and keep this as concise as possible. So let's take it all back to square number one. How does LGBT connect to mental health? Well, already the LGBT is at more risk for developing anxiety, depression, and suicidal ideation. One reason for this might be because of minority discrimination. This is a term that I found used by Mayer in their 2003 paper to describe people who identify as a minority who go under chronic stress because of fear of discrimination. This could be discrimination at home, or with their peers, or with public services such as healthcare, where they might be afraid that they may be refused treatment or treated inadequately because of the prejudice of the healthcare provider. So that's how people in the LGBT are linked to mental health, but how does COVID restrictions play into this triad? Well, if I may ask you to take a moment and just pause and think about your experience with COVID-19 restrictions. Think about it when it was just you and maybe the people you were bubbling with. What was that actually like for you? Take a moment just to go back there and remember what it was like when you were isolated from your friends, from your family, from going out and doing things, from having even a purpose to go out the house. Well, I'm sure for many of you, you're thinking, that was awful. Well, guess what? We have some research to back that up. So research from Kilgore in 2020 found that during this time period, more people were experiencing anxiety, depression, and suicidal ideation. And if you remember from a previous slide, I just mentioned that the LGBT community are already at risk for developing these already. So you can imagine that perhaps the COVID-19 is going to exacerbate these aspects even more. But furthermore, I've got evidence from the Trevor Project, their 2021 survey, which basically found that the LGBT community were particularly struggling with these restrictions. And if you want kind of like a deeper insight into what it might have been like for the LGBT community living under the restrictions, imagine when I asked you to imagine what was the pandemic like for you. Now please put yourself into the shoes of someone who is LGBT. Imagine you're a person who is living with people who hold discriminatory views against you. Imagine this might be your parents even. Imagine this is someone that you previously thought was your friend. Or maybe they're just some people that you've just got your uni accommodations with. Imagine maybe you're a trans person who previously could go leave the house, to leave that area where they're being discriminated against, to go to school or to work or to uni maybe, to escape from that home where they are dead named and unrespected. Or for another example, imagine a gay person who goes home to that household where they are bombarded with judgment, and previously they could escape that, but because of the restrictions they no longer have that escape. So it does kind of make sense why the LGBT people are going to be heavily affected by these restrictions. So now this triad should be clear on why we are so interested in investigating this. And so we are, as researchers, we understood mental health is a very big topic to take on in one study. So that's why we have decided to break it down into 3 sections: anxiety, connectedness, and resilience. So really, why did we choose these 3 things? It leads us to the main 3 questions that we're investigating in the study. How was their mental health doing? Did the pandemic have an effect on LGBT mental health? Did these people have any social support? Maybe did they find support online? Maybe the majority of people actually found that people aren't so homophobic, transphobic, discriminatory. And so they were fine during the pandemic. Or maybe it wasn't down to their social support, and they actually found that because of their resilience, they were able to withstand the hardships that they underwent. Maybe did they find their mental health was actually not affected at all, and they found that the pandemic was a breeze. Who knows? That's why we're investigating it. So, how did we test this? We asked participants to identify themselves as LGBT or cisgender and heterosexual. This was a very important discrimination. Distinction is the word I'm looking for. We needed to distinct whether you're LGBT or cisgender and heterosexual. And we need the and there because you can be both. You might be a transgender person who is straight, or you could be a lesbian, gay, bisexual person who is cisgender. And so we definitely need to make sure that those are very much distinct in order to see if people in the LGBT community are being disproportionately affected, as research suggests. And then we got these groups to complete 3 questionnaires 3 times. The reason why we did this is because we need 3 times for before, during, and after the restrictions to test if there was an actual difference between their mental health before and after and during the restrictions. And we do recognize that we are going to be asking them to recall what was their mental health like before and during their restrictions. So we're asking for a past recollection kind of thing. And then we also needed those 3 questionnaires for the 3 areas that we are studying in mental health, which is their anxiety, resilience, and connectedness, as shown in our handy little chart down there. So what did we find from this study? We did not find a significant difference for resilience and social connectedness, but there was absolutely a significant difference for anxiety levels in the LGBT community in comparison to people who identify as cisgender and heterosexual. So what does this mean? Everybody suffered pretty much equally. Everyone was pretty much been put under the same circumstances of being kept indoors and being isolated away from other people. So this is kind of very much understandable. It makes sense why there was no difference. Everyone's resilience suffered the same. Everyone's social connectedness dropped because we were all put in the same situation. There was no real difference in terms of that. We were all with our families, and maybe in the pandemic everybody got a little bit sick of each other because everybody's resilience and social connectedness dropped during, and then it kind of returned to the same afterwards. However, the LGBT people's anxiety worsened during the pandemic, and it never really quite returned to the same as it was before the pandemic. But one thing that was quite interesting that we found out from our results is that during the pandemic, the heterosexual participants that we had, their anxiety levels worsened, which we expected, but it was to the same level as the LGBT participants experienced prior and after the pandemic. And I realize that might be a lot of words, so just to sort of explain that, the amount of stress that the heterosexual participants went under because of the pandemic restrictions was the same amount of anxiety that LGBT people experience normally. Interesting. It's got a lot to say about maybe minority discrimination, but we'll get onto that basically. So I guess the first question that would come out of our research is that, was it safe to let LGBT people who are already at risk for anxiety, depression, suicide go home during the pandemic to people who would be discriminatory against them? Obviously the restrictions are over now, so we can't do anything to change that. But as our study kind of suggested, that anxiety levels are affected by the pandemic and they were more anxious when the restrictions were in place, I think particularly it would affect the trans people more, because we need to ask ourselves, is it safe to let transgender people go home during times of crisis? To put it into like context of the world we're living in right now, it is a very scary time to be a trans person. If you've heard anything about the news in Florida, there's essentially been a lot of bills being put into Parliament about which would essentially give Florida the ability to strip parental rights from parents who support their transgender children, basically coming out as like, sorry to explain, to take licenses away from people who would provide transgender affirming care for youth or adults. Obviously this isn't currently in place, but the fact that a bill is being introduced like that into American Parliament is very concerning for what might happen to the UK. And the reason why I give this context now is because we've actually had very few individuals disclosing the fact that they are transgender in our study. I think we only had a total of 9 participants in that, and we may have had more individuals in our study who are transgender but might not want to disclose that, and that is very understandable considering our situation. There's also, this would also apply to individuals who don't want to disclose their sexuality either, and this might just be because of just general discrimination, but as I said, it's going to be more relevant for a transgender person in, you know, our current climate. Another question that would come up from our study is that we have only used short form questionnaires because it was kind of like an exploratory study where we want to just test, you know, was resilience affected? Was social connectedness affected? Was anxiety affected? We didn't know. And that's why we just kind of wanted to test our waters a little bit, dip our toes in kind of thing. There's a lot of evidence pointing, you know, in our prior research, pointing in many different areas of mental health. These were the 3 that we just wanted to test out. However, future research would want to do longer questionnaires to investigate maybe the depth and breadth of this, like the validity of it. We were also worried that even with the incentives of, you know, please do my study to our friends and undergraduates, have course credits, do it, get your degree. A long questionnaire with 9 parts is a lot to ask for people. So that is why we use this short form version for our master's thesis, but future researchers might want to do more of it. So yeah, I would suggest that in TLDR form, future studies would want to consider going into more depth with anxiety, COVID restrictions, and LGBT. As for our final question with the study, I had a look at the demographics of our study, and the age range for most undergrad students is 18 to 21, and this range made up 57% of our population. And if you want to stretch that and say how many young people did we have in our study, so I said about 18 to 25, that would be 72% of our population. So while our study kind of aimed to look at the general population's experience with COVID-19, we probably just actually found out mostly the young LGBT experiences of mental health and COVID. Additionally, looking at the ethnicity of our participants, 89% of our demographic was white. So again, we have to ask ourselves, are we looking at LGBT mental health or just white LGBT mental health? Obviously, this is kind of expected because we're a university in Wales, but still, we're not looking at general population, we are looking at the white population. So these results are not particularly conclusive in terms of the general population, as I said, but it's good to keep that in mind when looking at our results, because, for example, a different ethnicity group or an older generation might have found that their resilience was more affected for the LGBT, for example, but we don't know that. And as I said earlier, about our transgender population, who I was previously concerned about, our demographics said that we only had 9 self-identified transgender people, which, as our study had over 100 participants, that's very low. And yeah. So when we're speaking about our results, we're actually only speaking mostly about LGBT people, not LGBT people, unfortunately. So that pretty much concludes my presentation on my research. Thank you so much for listening. And I just want to say that if you have any questions, please pop them down in the comments. And if you want to have a look at my references, that will also be there. My email, if you have any questions that require a bit more typey, then it is mlm18cxk@bangor.ac.uk. Thank you so much again, and have a great rest of your day.